Hello, I'm Dr. Julian Sampson and I have a very special interest in TSC. Now I'd like to share some of my experience of the disease with you, from my point of view. I think all families with a newly diagnosed child with TSC should be offered the opportunity of genetic counselling. Although children with TSC may be receiving some form of clinical care, I've found that most healthcare systems won't automatically extend this care to the consideration of genetic issues for the immediate or extended family. The clinical geneticist can also offer assessment of the parents themselves. This may involve genetic testing to establish whether their child's form of TSC is familial or sporadic. And of course, if a parent is found to carry the gene for TSC, there may be implications for the parent and the extended family. This includes siblings of the affected parent, as well as more distant relatives. The clinical geneticist is the medically qualified individual who will be quite involved in TSC diagnosis and the management of the family, and in liaison with other specialists. The genetic counsellor, on the other hand, is particularly expert in reaching out to the extended families and working through any communication difficulties in the family to help its members understand the genetic situation they're in and to help them get the advice they want. I'll frequently see patients, particularly young patients, where the disease hasn't yet expressed all its manifestations. Without an expert assessment, there may be a delay in the diagnosis of TSC, so we'll see patients in our genetic clinic for genetic and diagnostic issues, and sometimes we'll see other family members too. Paediatricians generally take a broad view of the child's care, but they often seek advice from other specialists if the child has a specific manifestation or complication that they feel unfamiliar with. I'll also often pull in additional specialists for their opinions and to provide ongoing management for patients. For example, I'll see female patients who have respiratory symptoms, and if they have evidence of TSC-related disease LAM, I'll refer them to a pulmonologist. If they have renal function problems, I'll pull in a nephrologist to help with their care. And if there's a large AML, the most common renal manifestation of TSC, I may pull in a urologist. So for me, it's very much a coordinating role. We often find that when patients become too old for paediatric follow-up, and when they need transfer into an adult care setting, things tend to fall apart. There's more that can be done for this adult patient population. Aside from geneticists and primary care physicians, dermatologists, pulmonologists, neurologists and specialists in learning disabilities and nephrologists have a crucial role to play in the management of adult patients, as these specialists focus on serious adult symptoms of TSC. So much more is possible, and there's significant room for change.